Hello everyone, welcome to Talking Health with Dr. Laz, your favorite health program on television, reaching you from your channel of choice, AIT, from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. 2 days ago, December 12, 2021, was commemorated as the Universal Health Coverage Day. It's one of the international health days set aside by the World Health Organization, WHO, to lead advocacy to ensure that everybody have health insurance, and be able to afford the health care they need without financial difficulty. What is universal health coverage? Let me read it directly as WHO defines it. Universal health coverage, in short, UHC, means that all individuals and communities receive the health services they need without suffering financial hardship. It includes the full spectrum of essential quality health services, from health promotion to prevention, treatment, rehabilitation, and palliative care across the life course. So the life course begins from pregnancy, birth, the childhood, adulthood, elderly age, until the person passes on. So I'm going to be talking with a number of experts, at least 3 of them today, and we are going to be hearing their thoughts or their perspectives on how Nigeria can attain universal health coverage not later than the year 2030. Because the Sustainable Development Goals and the UHC target is that by 2030, every country of the world should be able to ensure that the citizens are able to afford the health care they need without financial difficulty. So you'll be meeting my guest in the studio. In the course of it, I'll bring you an interview with a health economist. And also the second segment will feature the Director General of Data Health Contributory Health Scheme, who is overseeing health insurance in that state, just to get a feel of what's happening within the state. So let's take a break, and when we return, we get into the conversation proper. We'll be right back. Welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, with me in the studio is Aanu Rotimi. Yeah. Yes, she wears a lot of hats. She's the Executive Director of Center for Accountability and Inclusive Development, CAD, and also the Chair of FCT Accountability Mechanism. You're welcome to the program.
Thank you.
Yes, looking at universal health coverage, the government of Nigeria through the National Health Act, Section 11 provided for the Basic Healthcare Provision Fund. And 50% of that is dedicated to health insurance and is regarded as the minimum investment the government has to put, hoping that there will be donations, there will be other contributions, and also other schemes to achieve universal health coverage. So at FCT Accountability Mechanism, I'm aware that you're leading advocacy within the FCT to ensure that healthcare services are accessible, available, and of course of good quality. So what is your impression generally as a strong advocate in this space on how far we've gone towards achieving universal health coverage?
Thank you so much, and thanks for having me here today on this program. And I can say that you're doing very well, and we are proud of having this kind of program to sensitize and educate Nigerians on how we can actually improve the health sector, how everybody can participate in actually seeing that every Nigerian, everyone is able to access quality health care. And like you said, within the FCT, if you look at the FCT structure has constituted, we have 6 area councils. And like we've always said, nobody is actually a citizen of the federal. We are all citizens, start from our home, that starts from a community. A community belongs to a ward. A ward belongs to a local government, and local government belongs to a state. then before we have a national. So if we look at this spectrum of structure of our society, we realize that in the FCT, we are not eluded, even though we don't have the local government system as it's applicable across all the states. But in FCT, we have the area council. So because of the area councils now, we've seen that in FCT, let me pick up on the service delivery. You know, the basic healthcare provision fund is basically in three folds. We have the part of the demand generation, which is actually the ones that buy the healthcare services. That is the health, you know, the health insurance. The 50%. The 50%. And we have the supply side. That is the 45% of basic healthcare provision fund, which actually is talking about service delivery. You know, they ensure that there's availability, quality healthcare is available for citizens. And we have the 5%, which they will not be talking about the medical emergency treatment. Support, so we will look at the 45%, which is actually directed at delivering quality health care at the primary health care, and which have been identified as the first point of contact. If you want to say in FCT right now, across the 6 area council where we have dedicated facilities that will align with the one functional PACs per ward, at least one functional PAC per ward policy of the government, we realize that right now, are we really having that? Yes, we are doing some things. The FCT is doing some things, but we can do better. And yes, and you know, because we also got a support from a donor, we were able to develop a scorecard thanks to HAF, Association for Reproductive and Family Health. You know, we supported us through the integrated health projects that they got support from too. We were able to do an assessment of all these 62 facilities across the 6 area councils. That's 10 facilities per.
So from your findings, do you think you're on the path to achieving universal health coverage?
So from our findings, we realized that there's still a little bit more to be done, especially in the areas of human resource for health.
Okay, that's health workers.
Yes, health workers. You know, we are not having sufficient hand at the health facility. We also have the issue of infrastructural, the KC, because the infrastructure at these facilities needs to be improved upon.
By infrastructure is a general term.
Yes,
lights, water, building.
Water, lights, the building, the state of the building. You know, the building needs to be conducive for people to come. So we are still a lot of improvement. Even the issue of governance. It also needs to be strengthened. Citizen participation in issues of health that concern them. So these are some of the few areas we've identified as areas of concentration that needs to be enhanced, because citizens need to be. So to
address this, you need money. Yes. And I would like you to respond to this like within 60 seconds. So it's been argued that security requires money, everything is asking for additional money.
Definitely.
And many have argued that we are not getting value for money, even for the one we are spending.
Yes.
But to achieve universal health coverage, everybody must have a form of health insurance or the other. So what's your recommendation to the government of Nigeria, especially at the subnational level, on what we need to do to get this achieved not later than 2030?
Subnational government, especially let me speak to FCT right now, and every other state, must invest in health. They must own their health budget. Number one, they must allocate not less than 15% of their health budget.
FCT allocated 16% in 2020.
So it's not about allocation. I was coming to that. The first step is about allocation. The second one is about release. You must release the funding. The funding must be able to go to where it is, and it must be properly channeled to where it's meant to be. Because if you don't channel it appropriately, you cannot have a very big magnitude overhead cost. I have little or nothing for capital. So we must ensure that, and we know that in health, we also have some capital recurrent. So we must invest in those areas, and there must be release, timely release, not the one that when the head is ending, you now start releasing and start. No, there must be constant and effective release, efficiency use of the resources.
Right, but how can we get more money for funding health?
So how we can get more money is also about, first we need to lock up the loopholes within the system. There must be efficiency, there must be appropriate accountability, there must be transparency. Also, we must also start looking at other sources of income. For example, we have the the luxury tax, for example. We are hoping that federal government will give us. We have the sugar, sugar tax is there.
Tax,
we have the smoking tax, the alcohol. So some of these other things that actually, if you look at the relevant on health, is not actually contributing. But so we can look at this other way. Some of these tax they should add to health, because these some of the things. The health sector is the one bearing the burden of all these things that is happening. So these are other sources of income that can be used to get health financing in the country.
Okay, that's a good thought out there. So thank you very much, Aanu Rotimi.
Thank you.
Chair, FCT Accountability Mechanism, that's Federal Capital Territory. Yeah. I'm going to get other perspectives on this topic. So we hope we continue with the advocacy, and we pray that the government of Nigeria at national and subnational level gets to hear these recommendations.
Thank you.
All right. So thank you very much. We are going to listen to an expert, Dr. Nkata Chuku, who is the founding partner, Health Systems Consult Ltd. He's also a health economist and someone who has done a lot of work towards ensuring that Nigeria achieves universal health coverage. So I asked him two key questions. I asked him the recommendation he's making to the government of Nigeria to ensure that we get better results. And I also asked him how he feels about the state health insurance commissions or health insurance agencies, what they need to do better to ensure that more citizens, civil servants, informal sector get insured. So this is what he said.
Really, we've talked about universal health coverage for a very long time, and there have been some progress made, but I think this is the time to go strongly beyond lip service. I think for me, and a lot of us who are policy analysts have been drumming this fact, we need to have a very robust national health insurance fund, and I think this should be funded via a special tax. We've advocated tax, telco tax, or some proportion of VAT or something, so that we have a pool that can actually take care of every Nigerian. And if nothing else, we know that one thing we benefit from paying tax in Nigeria is having health insurance. The second thing is, I think the SDGs need to be disaggregated by states, because this Nigeria is not achieving SDGs across different goals, same that happened with MDGs. It's allowing a lot of states get away with not really doing their work. So disaggregating SDGs to states will really help, because that way we can see which states are doing well, which states, some states might achieve the SDGs, some others might not. And linked to that is making SDGs and UHC a campaign issue for 2023. Let every state, gubernatorial, House of Reps, senatorial, every candidate at every level tell us what specifically they will do to reduce maternal and infant mortality and increase the life expectancy of Nigerians. So, like you mentioned, performance is really varied across the states, with some doing significantly better than others. One key thing that has stood out, and is the same at the national level and at the regional level, if you look across countries, is the issue of political will. Where you find the states where the chief executives, who are the governors, are keenly interested in health insurance, you see a lot more progress. The second thing is the institutional arrangement and management capacity. But you see, what states should consider is that if you look at the current financing mechanism, right, with over 60 to 70% of all Nigerians who have any form of employment being employed in the informal sector, the burden on the states to subsidize will be very high. And again, which is where that link between what I was advocating for earlier, a national fund for health insurance that is well financed, to be able to really take that huge burden of the poor and underprivileged, so that states can focus on the individuals who are able to pay, the civil servants and all that, and also make their own contribution. I think every state should honor the commitment they've made in their laws to setting aside a portion of their state consolidated revenue fund, CRF, for health insurance. When you look at Delta, one of the things that is working well with Delta is that they do release as at when due, the portion of the CRF. Every state has something in their law. They actually need to implement those laws. You know, that's one critical element, which is why we need to give health its proper role in the political agenda. Because if we do not elevate health to the same level of priority as roads and bridges and other construction work, right? We will treat it as that secondary, tertiary issue that is just a token. Occasionally you do mass awareness or mass health programs for the people. So the governors should live up to the commitment they've made in their health insurance laws. There is no need setting up a health insurance scheme backed by a law, and then you give tokens to the health insurance agency. It's just for overhead. You need to put money in the pool. And citizens will not have any confidence to come out and buy packages for those who can afford it if the government is not putting its own share in the pool. So government must live up to its responsibility so that citizens can be convinced to follow suit. Thank you.
Okay, I'm sure that the appropriate authorities will listen to that and also implement those recommendations. So let's take another break. When we return, I'm going to be introducing the Director General of Delta State Health Contributory Health Commission, and he's going to share his experience at the state level as someone who was championing the implementation of health insurance at the state. So do stay with us, we'll be right back. Welcome back to the program. My guest in the studio is Dr. Ben Nkechika. Dr. Ben Nkechika is the Director General and the Chief Executive Officer of the Delta State Contributory Health Insurance Commission. He's in the studio and is going to speak with us briefly on the experience leading health insurance coverage in Delta State. Recall that almost all the states, or perhaps all the 36 states, now have health insurance agencies that were established within the last couple of years. So it's not just NHIS that we have now. Almost every state, if not all of them, have health insurance agencies. So welcome to the program, sir.
Thank you very much.
So looking at Delta State, the Contributory Health Insurance Commission, how many persons are you providing health insurance to, and what has been the experience like? Relating it to universal health coverage and Nigeria's goal to have everybody to be covered by the year 2030.
Thank you, Laz. The Delta State Contributory Health Commission currently has over 1 million enrollees that are part of our health insurance scheme. That basically equates to about 20% of the population in terms of population coverage. And our enrollee categorization is into the equity health plan for the vulnerable people, particularly pregnant women and children under 5, and then the formal sector enrollees under the formal health plan for the public sector workers and the organized private sector workers, and then the informal health plan for those that don't belong to the equity health plan and the formal health plan. And okay. We have tried to categorize our enrollees under that bracket with a significant number belonging to the vulnerable group, the equity health plan.
Okay, that sounds good. Over 1 million, that's very impressive. And I do not think there is any state that perhaps have their 20% covered. So how did you get there? Is it only the government that is paying for them, or do you have a category that's contributing as well? Do you have employer-provided, private sector employer-provided persons who are on this health insurance scheme?
Yes, like I said, we have 3 basic category of enrollee plan, and the most significant is the equity health plan for the pregnant women, children under 5 that are part of the vulnerable group. So when we started our scheme on the 1st of January 2017, we transitioned the free maternal and under 5 healthcare service of the previous administration, and it was transitioned into the health insurance scheme. And that's what we started with, and we currently have a significant number of enrollees in that category. And the government pays the health insurance premium for this category of people. They come under the pregnant women, children under 5, elderly above 65, physically and mentally challenged, and any other person that, using our various methods, are considered poor and vulnerable and unable to pay their health insurance premium. And then we also have the public sector workers whom we engage with from the beginning, and basically all public sector workers, civil servants in Delta State and their families are covered under the health insurance scheme, under the employer-employee contribution, where a percentage of the employee per salary or remuneration is put in as a contribution, and the government makes a counterpart contribution on behalf of each of those enrollees, and that covers the worker and the family of wife and 4 children. And then we have the organized private sector, which covers those under any employment above 10, and we have continued to grow that relationship using the Nigerian Labour Congress and the Trade Union Conference, who have been very, very cooperative with our scheme. And then the informal health plan, which we have consistently grown, though it's a bit at the low side, but we're putting in measures to grow that. Those ones pay a yearly premium of 7,000 per person per year.
Okay, so thank you very much. Finally, the goal of WHO is that every country covers everybody, not later than 2030. So having done 20%, when do you see Delta States being able to cover 100%? In what years, sir?
It's a very difficult question to answer, but we actually had a policy dialogue spearheaded by UNICEF that had representatives from the World Bank, the WHO, and other partners. And my chairman, Olorogu Dr. Isaac Apogeta, actually made a declaration that we will attempt to achieve at least 70% by probably 2023, and then target to ensure that we cover 100% before the 2030 United Nations mark. And we have a lot of strategies to do that. The Indigent Support Program, the improved cooperation with the Trade Union Congress and the Nigerian Labour Congress, and various legislations and processes using our ICT platform to ensure that we have an efficient, compliant biometric registration process that covers every Nigerian. We're currently doing a house-to-house advocacy and household enrollment process to ensure that we capture every resident of Delta State into the scheme, and then work our modalities to either support them to pay for their health insurance premium for those that can't pay, or we get philanthropic organizations to make contributions towards that, and those that can pay, we set up a payment plan for them. So we believe that with these various measures and our elaborate, robust ICT system, we'll probably be able to achieve that. Thank you.
All right, that sounds good. Thank you very much. So if you do 70% by 2023, we do hope that, you know, the next administration that will come wouldn't find it difficult to do 100% by 2025.
Yeah, we believe that if we follow the current trajectory, but the most critical part is the component where there's that collaborative relationship between the people and government, the people and the health insurance scheme, because it's a combination of all that, ensuring that people take the ownership of the scheme and take ownership of the entire advocacy process, combined with the support and efficiency of quality service from the healthcare providers. We believe if all that is in place, we should be able to achieve that. It's a tough goal, but we'll do our best.
Thank you very much. That's quite reassuring. I'll be speaking with Dr. Ben Nkechika, the Director General of Delta State's Contributory Health Scheme, right? Yeah. You know, so thanks for being on the program. So we hope that every other state we also do likewise to ensure that by 2030, every Nigerian has health insurance cover. So that's how we take it today on the program. Do stay with us, same station, same time next week. My name is Dr. Laz Eze. Bye for now.